Hello, future Rossies and pre-med explorers. This is Milena Garcia, your host for Ross University Checking the Pulse, a pre-med podcast. This is our mini podcast featuring facts and information about our medical program, insights from current students, and tips from practicing physicians. Each week, this broadcast will be broken down in small episodes, focusing on one aspect of our program, also having guests talk about their own experiences as students and as doctors. Plastic surgery is a highly competitive surgical specialty. It can be a reconstruction or an alteration of the body for the purpose of rebuilding or improving the function, or cosmetic for improving physical appearance. My guest today is plastic surgeon Dr. Sola Fasusi, class of 2010, who shares his experiences preparing for the MCAT, studying for medical school, and during his residency training. Welcome back, future Rossies. Thanks for joining us again. So today we have Dr. Sola Fasusi. Dr. Fasusi, thank you for joining me. Let's have you take a moment to introduce yourself.
Hey guys, how you doing? I'm Sola Fasusi, a Ross graduate in 2010, and I'm here today with Milena to talk a little bit about plastic surgery.
Tell us a little bit more about your background.
Well, I'm from Maryland, grew up in the DC area, went to Morehouse College for undergrad, and after that matriculated into Ross. Like I said, that was around 2005, 2006. Graduated in 2010, and then after that went to general surgery residency at the Medical College of Georgia, and then subsequently did my plastic surgery training at University of California, Davis.
What is plastic surgery? Can you cover all the aspects of it?
Yeah, of course. There's actually a lot of different elements to plastic surgery. Most people just think about the cosmetic element of it, but it's a very broad and depth field. So there's hand, wound, burn, craniofacial, microvascular, reconstructive, and of course, cosmetic. And so within that scope, you can see there's so many different elements of plastic surgery, which is one thing that really drew me to it, because it's almost like the sky is the limit. You can get a chance to operate from top of the head to the bottom of the toes, and really all aspects of the body.
And how do you get into this specialty?
There's mainly two routes at this point. There's the integrated route and then the independent route. The independent route was the more traditional route of getting into plastic surgery. So what I mean by independent route, that means that you've basically gone through an accredited surgical residency, most commonly general surgery, but you can also do things like ENT to a lesser degree, urologic specialties and whatnot. But traditionally, it's been mostly general surgery. You've completed that residency program, and then you would matriculate into plastic surgery residency. And so that would be an additional 3 years. More and more now, though, most programs are switching over to an integrated program, meaning that right out of medical school, you would basically be applying to go into plastic surgery residency, which is 6 years straight through. And within that 6 years, you would spend some time, rotating through different surgical specialties, general surgery specialties and whatnot, but your main focus and crux would be focused on plastic surgery throughout those 6 years.
Now, we always hear that getting into plastic surgery is very competitive. How competitive is it? And would there be a difference between the two routes?
Traditionally, it is very, very competitive, no matter what. And it's always been competitive, like most surgery specialties are. This is probably the upper tier of the competition. The independent route, and just to reiterate again, the independent route where you would do a surgery specialist or surgery residency at first, and then matriculate into plastics, was the more common way for a long, long time. And there were many, many programs. It's getting competitive on many fronts because from an independent program standpoint, the number of those programs are actually shrinking. And so matching into plastic surgery right out of after you finish your residency is actually pretty difficult now. And then the integrated routes where you would match right out of medical school have always been very, very even more competitive than the independent routes. And so because of the shrinking nature of the independent routes, the integrated route, which was already very competitive, is becoming even more so. So it's just really, really key that you have to start thinking about, doing extra and differentiating yourself as a medical student at an earlier time point. You can't really wait till the latter portion of medical school to start making those decisions. It's important to really start at an earlier stage if you're going to match into something. And that just doesn't apply to plastics. That's any very competitive surgery specialty, no matter what.
And as you mentioned, this is the top, right? And there you are. So you've accomplished it. First of all, I want to recognize you for all your hard work and your accomplishment. There's certainly amazing skills that you have to be this kind of complete doctor. So I think you're qualified to answer my next question, right? What kind of skills do you need to be a complete surgeon?
That's a good question as well. Any great surgeon is going to be a critical thinker, because the thing about being a surgeon across the board, no matter what kind of surgeon you are, especially with plastics, is that you have to be able to problem solve and critically think sometimes on the fly, because when you are attempting to fix very complex problems that are trying to restore somebody, for example, from a state of abnormal, whether it be from trauma or congenital or whatever the case may be, to quote unquote state of normal, there's a lot of different ways to skin a cat, as they say. And so being able to kind of critically think and have that capability is an absolute must as a surgeon, but especially as a plastic surgeon. Obviously, technical skill is very, very important as well. Being able to start working on your manual dexterity at an early point is going to help for sure. That's with all surgeons, but again, especially with plastic surgeons. And so, we're operating doing very, very complex things, very, very tedious things. You're hooking up small little blood vessels under microscopes sometimes. And so it's very, very important to have those technical skills as well. And so once you have those two, that's kind of like the baseline core of like what you need: the ability to critically think, and then the ability to have technical skills. And so you can build up on that. Anybody who's gotten into medical school and matriculated through medical school and is obviously a smart cookie. And so textbook smart is not something that's only relegated to one area of medicine. I think we're all students and scholars and are continuing to kind of, better ourselves in our craft as students. But at a baseline, I think that's what you need to be a good surgeon and definitely a good plastic surgeon.
I can't be the only person thinking at this point that having a plastic surgeon talk about how to skin a cat just sounds different coming from you. I got stuck on that.
There's many different ways to do it. I can explain that too.
Yes. So it sounds like you talked about how diverse plastic surgery is in the many different ways to skin a cat. It sounds like there's not a typical day for you. So can you just describe a day in your life?
Sure. I mean, my day now is a little bit different than my day when I was in training, because obviously when you're going through plastic surgery training, I think that's something that kind of that's going to give you the springboard. It's going to give you the kind of platform to decide, when I'm finished plastic surgery, do I want to practice general plastics and kind of do a broad amount of things? Do I want to kind of subspecialize in one area of plastic surgery or another? So in training, you get a chance to kind of really go through every element of it and really kind of dive deep. And so, I guess I'll talk about, my training experience first, and then my typical day now, because I'm more on the cosmetic side of things at this point right now. And so the subset of what I do is a little more narrow than what I did in training. So, in training, essentially, we would rotate through different areas of plastics. Sometimes it would be rotating at the VA, where obviously you're taking care of older generation of veterans. Those are typically kind of relegated to a lot of skin and soft tissue diseases, cancers of various types, a lot of hand surgery and carpal tunnel surgeries as well. You could rotate through essentially what we call kind of a private-demic setting. There's kind of a difference between academic medicine and private practice medicine. Depending on what training program you go to, you can maybe get a mesh of both, where you're kind of in a private setting, but you're still a resident operating through that system. And in that setting, it's great because you can get a mixture of things like, cosmetics as well as general plastics. And so we would rotate through the pediatric hospitals. So that means that's where we're doing a lot more of our craniofacial surgery. You're doing small little ear reconstructions on patients, microtia surgeries. You're doing craniofacial things like craniosynostosis, where the skull is deformed and you're actually completely reshaping and remaking the skull of a small child, doing cleft lips, cleft palates, things like that. And then essentially with our trauma colleagues, the traumatologist, whether it be the general surgeon traumatologist or the orthopedic traumatologist, doing reconstruction of upper and lower extremity after, various different types of traumas, doing different free flaps to cover big holes and whatnot. So on a day-to-day basis, especially when you're in training, you could be doing any number of things depending on what you're rotating through. And so it's almost like the Wild West in a way, but that's a great way to train. It's like having a huge textbook and you just basically getting to read all kind of different chapters all at the same time. It's really good. There's one thing I love about plastic surgery is there's absolutely nothing monotonous about it, especially when you're in the training realm. You get to see and do so many different things, and it's just, honestly, for me, somebody like me who would kind of get bored with doing the same thing over and over again, it is fantastic. My life now is a little bit different because I'm on the cosmetic side of things. And so, I'm in a situation in the practice where we kind of routinely more or less focus on body cosmetics, body contouring. Brazilian butt lifts is a thing that is very, very popular right now. And so that's, what we try to excel in. Obviously, breast aesthetics, facial aesthetics, all those kind of different elements of aesthetics, it can be broken up into its own subset of a subset of plastic surgery. And that's kind of what I'm focused on now as well.
At which point in your academic career did you decide that you were going to go into plastic surgery?
I always had an inkling, but I think like most medical students, you don't know until you know, right? And so many times or so often, your decision will be kind of molded by your experience. And so if you're in a situation where you get a chance to, rotate through and do a plastic surgery rotation, and you loved it, and the experience was amazing, and your teachers are great, and they're trying to show you all different aspects of suturing and all those kind of things. I mean, it just draws you to it, right? Especially if you already kind of were heading in that direction. The same can be said about any type of a rotation, but I knew kind of early on, even coming into residency, that's sort of what I wanted to do. And that's the thing about doing general surgery is great because I went through the independent route, obviously, when I did general surgery first and then decided I wanted to do plastic surgery and did that. Well, doing that was great for me too, because general surgery is another realm where you get a chance to rotate through all these different aspects of surgery. You're doing vascular surgery, surgical oncology, minimally invasive surgery, transplant surgery, trauma, critical care, you name it. And so there was an element of me that also was very, very drawn to that. So, it just kind of, I guess maybe by my second or third year in residency, it kind of was solidified that I really, really wanted to do plastic surgery. And one thing that actually really helps a lot that I always kind of advise any medical students who I'm kind of mentoring to do is, try to do, a sub-internship in whatever specialty it is that you think you want to do. Because, doing a rotation is one thing because you don't really get the full aspect of what's going on. But when you do a sub-internship and you get a chance to spend a solid month, for example, doing just plastics or just vascular surgery or just cardiology or whatever it is, you get a really in-depth look, more so than you would on a regular rotation, to kind of figure out what it is you want to do. And you might get there and say, I really want to do this, and then realize that this is nothing like I thought it was. Like, and I don't want to do it, So doing that will, is actually dually beneficial, because it'll really give you an aspect of, a closer aspect of what it is that you're getting yourself into. And on top of that, you're making a lot of key critical connections that you can use for, letters of recommendation, essentially, like, a foot up when you're trying to actually matriculate into that field. You notice I love the word matriculate. It's like, I said it like 3 times right now. It's like my favorite word.
Why Ross? Let's go way back then. Why Ross?
That's a great question. Well, my road to Ross was probably not the normal. Well, maybe it is the normal way. I don't know how everybody else gets to Ross, but
I'm not sure there is a normal way at Ross.
That's true. Exactly. When I was applying for medical school, I was in a situation where I took the MCAT, I think maybe my junior year in college. Did okay on it, actually, but decided I wanted to do even better, just to guarantee myself, a good set of options when it comes to medical schools. So I actually took some time off right after college, and I studied probably the hardest I've ever studied in my entire life. I mean, 8 months, 8 hours a day. I was just like, I knew exponentially more the second time I took it. I took the test again, and I actually did worse the second time. And that was kind of really devastating to me in a way, because, I put all this time and effort into it, and I'd gotten a result that was kind of baffling. But either way, I decided to go ahead and apply. I gotten waitlisted in a couple of places in the U.S. And a friend of mine that I'd met during MCAT prep course had told me about Ross. And I said, okay, well, I don't really know much about it, but, I'll go ahead and apply. Because they have rolling admission essentially every, continuously around the year, which is different because, usually you can only apply and get in one time a year in most schools. Well, I got waitlisted, and that means I was going to have to wait an entire additional year. Ross got back to me and said, and at this point I didn't know that, Ross is a good school, and I didn't know much about it, but it's also a little bit competitive at that point, to get in. And so they said, listen, we don't have any space in our class right now, but we have what's called the MERP program.
We did an episode on it. So for everybody listening, yes, please check back the MERP episode. It's episode number 2. So check back. How did it go?
I should be your co-host. That was a perfect plug. So,
yes, thanks for the plug-in.
No, it was great. I got A's in everything, and then I was guaranteed a position in the next class. And so I took that opportunity and ran with it, and it allowed me to matriculate into medical school. Favorite word again. But it also allowed me to do a couple other things. One thing I didn't realize when you're going to medical school is that, I didn't realize I didn't know how to study. I was used to things that kind of come easy to me. I can, read, remember, boom, boom. There's a certain way you have to study in medical school because the amount of information is daunting, and I didn't realize that I didn't know how to study correctly. One thing that MERP did for me especially was allow me to understand how I need to be able to study, which helped me incredibly through medical school, and actually even to this day when I was studying for board exams and things like that. So I actually went through the MERP program to get into Ross University, and kind of took off from there with the footing that I had from the MERP experience. So that's how I kind of got into Ross in the first place.
And here you are, from MERP to chief resident to plastic surgery. Dr. Fasusi, we're proud of you. We're proud of your accomplishment. Thank you for taking your time to speak with me today. Co-hosting the podcast with me certainly doesn't pay as well as plastic surgery, but you're welcome to come back anytime. Please, I would love to have you again as a guest. Any last advice or recommendation for our future Rossies?
Well, I mean, if there's any doubt in your mind that Ross can get you to where you want to be, I can be somewhat of a testament to the fact that, even my startings in terms of getting into Ross was hard, and with hard work and with a lot of help and determination and things like that, you're able to kind of make your dreams kind of a reality. And so, whoever is maybe kind of on the fence or thinking about, where they want to go or if they should apply and whatnot, and worried about, well, maybe their options will be limited. I'm kind of a testament to the fact that, listen, if you get in and you do what you're supposed to do, you can get exactly where you want to be. So.
Perfect. Thank you, sir. Appreciate your time. Thank you so much. And for everybody out there listening, thank you for joining us. We will see you next week.
Thank you for listening to Ross University Checking the Pulse, a pre-med podcast. This is Milena Garcia, your host. This podcast is made for you, so let me know what topics you want us to cover on future episodes. You can send me your comments, feedbacks, and requests to mgarcia@rossu.edu. Definitely follow us on Instagram, Twitter, and our YouTube channel at Ross Med School, or on Facebook. If you're listening to this podcast on iTunes, I am working my way to 5 stars, so remember to send me your comments and let me know your ideas. If you're on Spotify, remember to click on the follow button to get our future episodes. All right, see you future Rossies and Pre-Med Explorers next week. This mini podcast is edited and produced by our in-house guru, Chris King.